We have the two examination under medical. First, we have the physical examination is a process of evaluating objective anatomic findings through the use of observation, palpation, percussion, and auscultation. Palpation kana mo gamit kag two finger na iana nimo. And percussion is a method of tapping on a surface to determine the underlying structures and is used in clinical examination to assess the condition of the thorax and abdomen. So auscultation is a medical term for using a stethoscope to listen to the sounds inside your body. So katong gamit sa mga doktor katong magpa-check up katong tan-awon nimong naba kay ubo or something sa imong heart. And second, neurological examination is an assessment of sensory neuron and motor responses. Main tag sensory neuron are the nerve cells that are activated by sensory input from the environment. This nerve relay information from your skin and muscles back to your spinal cord and brain. The information is then processed to let you feel pain and other sensation. May tag sensory ka ng example, makeup kag ka ng initubig, siya ang mo release information padung sa imong brain para maka-feel kag init or sakit. So motor responses, ang assessment of motor response is designed to determine the patient ability to obey a command, to localize. The word localize describe disease that is limited to certain part of the body. And is a withdraw or assume a normal body position is to respond to a painful stimulus. And reflexes to determine whether nervous system is impaired. Mental reflexes, reflex action is an involuntary and automatic actions that your body does in response to something without you even having to think about it. So ang reflexes, wa nimo siya githink na musikad ka or nakay kuan dira mo kala siya sikad by mong part of the body. Marag wala involuntary siya. Yeah, nervous system impaired through brain spinal cord or nerves. So we have the procedures in identification or assessment. May tag-assess mo siya ang evaluation or mag-assess ka sa mga patient mo. So the procedure to be followed in the identification assessment of the crippled has as follows. So may tag-crippled mo siya disability, a physical disability, particularly one who unable to walk because of injury or illness. So first, we have the observation of the objective through the use of observation checklist. So tag observation checklist mao ni siya ang nadira ang ang question na imong gihimo na possible na tubagon sa usa ka patient or disability. Is a set question is evaluate the performance and behavior. So second, actual testing to determine the IQ and personality characteristic of the identified subject. So kato imong observation checklist naman to dito mga possible na question or kanang possible answer sa mga patient or nya imo pud tong pangutan-on dili kay kuanra kanang sa physical ka magtanaw but sa ilapong cognital or intellectual and the spot ka mangutana kung para ma-determine nimo or ma-identify nimo kung sa jud ang kuan sa patient. So third, we have the interpretation of the test result. So may interpretation kung naka-check naman kag or wrong, dira na ka mag-total kung unsa jud ang outcome sa imong pag-evaluate. So last is prescription for teaching purposes. So kaning prescription mo ni siya ang kung makakuan na ka sa kung makaibaw na ka og unsa ang outcome or result sa iyang kuan or sa iyang examination or assessment, ara na ka mag-advise or muhatan ng kag medication or treatment or mag-recommend ka kung sa dapat niya buhaton or iyang tambal baron. So classification of disability. Classification refers to the various groupings or crippled impaired. Three major classifications have been identified as follows. So first, we have the orthopedic impairments. May tag orthopedic impairments is defined as a severe orthopedic. So tag severe mo ni siya kuan na ka siya kanang grabe na kaayo that adversely affect a child's educational performance. The term include impairments caused by congenital anomaly. May tag congenital anomaly can be defined has structural or function anomalies that occur during intrauterine life is also called birth defect. So tapa siya sa tiyan sayang mama or nana siya ka ng kuan ba defect sayang congenital anomaly. And then is congenital disorder or congenital malformation. This condition develop prenatally and may be identified before or at birth. And there are three bone. They're referred to bone and muscular defects, just as first we have the poliomyelitis, known as infantile paralysis, is all synonym of poliomyelitis caused by virus or poliovirus. So, kaning poliomyelitis makakuha ni ang person ani murag through virus ba murag nakuha niya through sayang na pa siya sa MTN baron sa katungkuan pa siya, and the virus is spread from person to person and can infect a person's spinal cord causing paralysis. May paralysis ka na can't move part of the body. So second, we have the osteomyelitis. Tuberculosis of the bone and spine is an infection of the bone, a rare but serious condition. So rare siya pero serious siya, severe siya. So bones can be moved infected a number of ways. Infection in part of the body may spread through the bloodstream, so into the bone organ, open fracture or surgery may extort the bone of infections. So makakuha ka ani kung ma-infection ang imong dugo or na nya mo kuan siya mo katag siya sa imong bones ba. And tuberculosis of the bones severely affect the joints of the hips and knees. So when you get in contact with a patient suffering from tuberculosis by the transmission of M. tuberculosis, M. tuberculosis bacteria mo siya ang mycobacterium of the top 10 causes death of the world. So kuya dyan siya. So tuberculosis, an infection disease, is spread quickly from person to person from the air. So dali ka matakdan, dapat magmask jud ka. Kay kuan siya matransmit siya from air, from person to person through air. So we have the bone fracture. Break into continuity of the bone is a medical condition in which there's a partial or complete break in the continuity of the bone. So may bone fracture, for example, kanang basket ka, yan nabali imong tiil, pwede siya maka-cause og kuan kanang saan daw na maka-break siya sa imong bone. So it might be dila kakalakaw. So pwede na ka ma-disable. So muscular dystrophy is a deterioration of the muscle of the body which is usually fatal. In a group of inherited disease that damage and weakness your muscle over time. This damage and weakness is due to the lack of protein called dystrophin. So lack of protein siya is necessary for normal muscle functions. The absence of this protein can cause problem with walking, swallowing, and muscle coordination. So dystrophin is a protein found in the muscle cells. It's one of the group of protein that work together to strengthen muscles, fiber, and protect them from injury. Muscles contract and relax. So deterioration in the process of becoming progressively worse condition or deadly.